Hello, I am Dr. Subramanian Kannan, consultant and head of the Department of Endocrinology at Narayana Health. Last video during the World Diabetes Day, I had discussed about the Venn diagram of diabetes. Giving you a little brief outline of the last video's talk, we had discussed that diabetes is a result of two major factors. One being the environmental factors, which is modifiable and very much in our hands, including our diet, our lifestyle, food intake, exercise, stress, sleep, etc. etc. Then we also have on the other side genetic factors or pancreatic factors which decide how much of insulin the pancreas can effectively make. So a lot of viewers had the question, sir, how can I decide what is contributing to my diabetes? Is it predominantly lifestyle related or is it predominantly genetic factor related? Now, why this becomes important, as I had mentioned in the previous video, if the main factors that is causing diabetes is lifestyle related, then definitely working around the lifestyle factors, particularly working around the diet, exercise, sleep, stress, and the mind, definitely will help in reducing the blood sugars. And in fact, in some people, put their diabetes in what we call remission, meaning that their diabetes is no longer requiring any medications. But if the predominant factor is involving the pancreatic function or ability of the pancreas to make insulin, then despite the best efforts from the patient in terms of the diet and their lifestyle, the sugars don't come under control, and there is definitely a need for them to take medicines. Now, these are broad entities, and of course there are going to be some overlaps between the two. Now, the question that most of you asked is, how can I know whether my diabetes is predominantly because of lifestyle factors or is it because of pancreatic problems? And I told last time that the answer is not simple and it may not be quite apparent on the first visit. However, I think it is also important for me to give some suggestions or clues or some factors that as a physician, as somebody who manages diabetes every day, we look at closely and carefully and decide what will work and in what patients medicines may not be needed. So that distinction between which group of patients will require medications and what type of medications, and in which group of patients just mere lifestyle change alone is sufficient. So how do we decide that? So I think I would like to share some of our clinical experience here. The first and foremost clue is the age of onset of diabetes. The younger the age of onset of diabetes, that tells me that your pancreatic reserve is low. So if you get diabetes at age 60, at age 70, then by and large, with reasonably good diet and a fairly healthy lifestyle, you should be able to manage diabetes without much help of medications. On the other hand, if your diabetes comes at quite an early age, below 30, then I'm a little worried that your pancreatic reserve is not enough and that you may not have the reserve to actually stay on without medication for a long period of time. So the age of onset of diabetes is an important clue for us. The second important clue is your sugars at presentation. I have patients who come to me with a sugar of just above the upper limit. So somebody who's got a fasting sugar of 128, 130 and a post meal sugar that is around 190 to 200. Compared to somebody whose sugars are 450, a random sugar of 500. Now, these are two different ball games. The higher your sugar at presentation, the more likely that you have a pancreatic factor that is contributing to your diabetes, and you are likely to benefit from medications. So, the age at which your diabetes comes, the higher the sugar value that you present with will tell me whether you will need medicines for the diabetes. The third factor that we play into around is the number of family members who have diabetes along in your first generation family. So your parents, your siblings, the maternal side of the family, uncle, aunt, paternal side, the fathers, brothers, sisters, and their children, your paternal cousins and your maternal cousins. The more the number of people in the family with diabetes, the more likely you are also inheriting the same similar genetic trait, which means that your pancreatic function is decided by those traits, and hence you are likely to need medicines, and lifestyle alone may not be enough, because as time goes by, the pancreatic function is likely to go down. So, younger the age of onset, higher your sugars at presentation, more the number of people with diabetes in your immediate family members. So, those are first three key factors. The fourth key factor that I keep in mind is your body mass index, which is your weight divided by height square. Now, if you are somebody who is clearly overweight and obese, then definitely lifestyle measures in reducing the weight and helping you with diabetes control becomes an important element of treatment. So, if you are obese or overweight to begin with, then definitely weight loss will definitely help you put your diabetes in remission and thus help you stay off medicines for quite a while. On the other hand, if your BMI is normal, and you still get diabetes, then that is something that I'm a little worried about, that it is not the obesity that is contributing to your diabetes, which very likely will then mean that there is a significant pancreatic factor that is contributing to your diabetes. And there again, medicines may be of use. Sometimes the body mass index may not really tell us exactly how much of fat you have in your viscera, which we call the inner or the deeper fat inside your body. The BMI may not clearly tell us for sure about it, but the clue is that if you have a low BMI or a normal BMI and still have diabetes, that to me indicates the pancreatic function is not very appropriate. The next factor that I also consider is your fasting glucose levels. Fasting glucose levels is if you are on an overnight fast, you've been not having anything after your dinner, and say after 8 p.m. you've not had anything to eat, and the next day morning at 8 a.m. your fasting sugars consistently is high, your fasting sugars consistently is above 150, above 200, that's a concern for me. That tells me that your ability of pancreas to make enough insulin to stop the glucose production from the liver is weak. And that's an important clue that your pancreatic function is again weaker. So another clue from the lab reports that your fasting blood glucose being consistently high is a sign to me that over a period of time you are likely to need medications. And last but not the least, we also look at your HbA1c. Some people who come with extremely high HbA1c to start with, which is usually above 9%, so 10% and above, generally will need some amount of medicines in addition to their lifestyle factors to keep their diabetes under control. I hope I have given you some clues or tidbits to find out what is contributing to your diabetes. Is it lifestyle factors or is it pancreatic factors? So I've given you some clues in terms of earlier the age of onset, multiple family members being involved with diabetes, higher the sugar at presentation, higher your HbA1c, higher your fasting glucose, and normal body mass index or lower body mass index. These are factors that generally as a physician will alert us that you might need medicine in addition to your lifestyle changes. Now, this is not to downplay the lifestyle changes, but it's an important message that in addition to lifestyle changes, you might need medications. So, take care of your diabetes, understand what is contributing to your diabetes, and accordingly help yourself and your physician manage your diabetes better. Thank you very much.